his statements are not backed up at all. In fact, earlier he put out reports in which the reports were linked to non-existent studies. They were AI generated, and they studies that were in these reports did not even exist. And the authors of that were listed on them confirmed so that they did not exist. He's living in a fantasy world that he's inventing.
President Trump has doubled down on his decision to fire the director of the Centers for Disease Control and Prevention. Susan Monares was let go after refusing to rubber stamp what she called unscientific, reckless directives. Caroline Leavitt, the US press secretary, had this to say about the president's decision.
Her lawyer's statement made it abundantly clear themselves that she was not aligned with the president's mission to make America healthy again. And the secretary asked her to resign. She said she would, and then she said she wouldn't. So the president fired her, which he has every right to do. It was President Trump who was overwhelmingly reelected on November 5th. This woman has never received a vote in her life, and the president has the authority to fire those who are not aligned with his mission. A new replacement will be announced by either the president or the secretary very soon.
That was Caroline Leavitt. Let's hear now from Eric Feigl-Ding, who's chair of the NECSI Department of Public Health. Good afternoon, Eric.
Good afternoon.
How concerned are you about these firings or departures?
Well, we're living in very dystopian times. CDC used to be the shining beacon on the hill, and so to speak, in the world of public health, which the rest of the world looked up to for public health advice. And right now it's being burned practically all to the ground, because in addition to CDC Director Monares being fired after just 1 month of being Senate confirmed, 4 other leaders, including the chief medical officer as well as the chief of immunizations, also resigned as well. And basically, there's, RFK Jr. is the king of anti-vax. He led the largest anti-vax organization before. And now they're basically, now they're in on the inside trying to destroy all science and public health. And that's why this is a bloodbath. These are dystopian, dark times that we're entering. And I don't think the rest of the world should look up to the CDC right now, as long as Trump and RFK Jr. are in charge.
Well, the White House says the president has every right to fire those, quote, not aligned with his mission. Isn't it the case that, that the administration can shape the CDC in its own image?
Yeah, theoretically, it's the CDC is now a political organization because it's a Senate confirmed organization. The director is Senate confirmed now. But the issue is, the CDC's mandate is to protect the human welfare of its population, and that is not obviously aligned with Trump's mission to for whatever his agenda is. So being aligned with the president's mission is not the mission of the CDC. The CDC director is beholden, but again, it's a political appointment now.
Well, I just wonder whether the CDC fell into a trap, perhaps, of becoming overly politicized itself. I mean, one official that's been singled out by the White House referred to pregnant people, and, that Kennedy himself has drawn attention to the CDC promotion of abortion. Did the CDC sort of fall into a trap, really, of becoming aligned politically?
The CDC is agnostic about politics. It is inherently pushing whatever the science of public health and medicine shows. And many things just like are inconvenient truths, whether it's pregnant people, whatever the language it is, it doesn't matter as long as what they actually care about is promoting the health and welfare of the general population.
Well, and let's talk
about
the facts of health and welfare, because you're chair of a research institute at the Robert Kennedy Jr. talks about restricting access to COVID jabs. He talks about considering banning COVID jabs that use mRNA technology. He says that certain interventions are almost certainly, in his words, causing autism. Is there any scientific underpinning to what he's been saying on these points?
There's absolutely zero underpinnings around this. In terms of actual scientific evidence, all his statements are not backed up at all. In fact, earlier he put out reports in which the reports were linked to non-existent studies. they were AI generated, and they studies that were in these reports did not even exist, and the authors of that were listed on them confirmed so that they did not exist. He's living in a fantasy world that he's inventing, and I think this is where the reality of science meets the political dogma of what he's living in. And that's where we're in a downward spiral. Honestly, we're entering times in which I don't know if it's the vaccinated will inherit the earth, because basically he will destroy and dilute all vaccine advice for the most part in the coming months and years.
I mean, that is incredibly worrying. And I guess this whole rhetoric has contributed, hasn't it, to vaccine misinformation and vaccine hesitancy, not just in the US, but in the UK too.
Yeah, and this is also the reason why the shooter unloaded over 100 bullets into the CDC just 2 weeks ago. I think this misinformation, the saying misinformation goes around the world 5 times before the truth has time to get its boots on. And I think this is the CDC that is supposed to be shining beacon on the hill, but now it's spreading misinformation under the guise of RFK Jr. And the rest of the world is looking on us. And this is where I'm saying we need to stop going to CDC while this administration is in leadership and look to Canada, Europe, UK for guidance on vaccines, guidance on public health, and other organizations that focus on children like American Academy of Pediatrics. We literally are entering the darkest era of science I've ever seen. And I know climate scientists have been saying that for a long time, but in the world of public health, you thought the pandemic was bad. Wait for the next 3 years.
Well, that's chilling indeed. I wondered just if I could ask you about an announcement we've had over here today about the NHS offering a chickenpox jab. I mean, chickenpox is clearly, a nasty illness, and it can be serious. But given that most people get over it and, it's a sort of almost like a rite of passage of childhood in a way, is the offering of a jab going to actually boost vaccine hesitancy? Because, people might sort of say, well, why are we being forced to have these jabs that we don't really want?
I think, first of all, I think it's very important to get vaccinated because, just because it's a rite of passage, just because your ancestors did it, 50, 100 years ago, shouldn't mean and you should go through that rite of passage as well. And these vaccines are very useful because like the adult version, the Shingrix adult vaccine, in addition to preventing shingles and chickenpoxes, it actually has been shown to reduce the risk of Alzheimer's by 30 to 50%. Now, this is obviously off-label, but there's plenty of large studies that show 30 to 50% reduction in Alzheimer's. There's lots of other benefits to these vaccines besides just, the immediate, my kid has a few, red bumps for a couple of days and weeks. There are long-term consequences. And the vaccine is way safer than blowing through mass infection. And we know mass infection was not the solution during COVID because people got infected again and had long COVID for years and years. Yeah. We don't want that. A vaccine is much safer.
Eric Feigl-Ding, thank you very much for joining us. Chair of the Research Institute, the NECSI's Department of Public Health there.